to actually, because you're taking a public health approach and you want to prevent new HIV infections, if you're going to delay until you get Truvada registered or other generics, TDF, FTC into your country and your supply chain, 2-3 years down the road, you could have averted all those new HIV infections by using tenofovir lamivudine, first off. Secondly, so yes, consider TDF lamivudine. We've had a consultation with pharmacologists, experts. Now, friends of mine, gay friends of mine who are on PrEP, people, sort of living with HIV, yell at me a bit when I, consider, and sort of the agency considers TDF3TC as a permissive option, because they say no, like the best data, the most data rests with tenofovir emtricitabine. But then I go back to the WHO recommendation, which says oral PrEP containing tenofovir. Just to finish this, there's a few other countries that are considering this because they don't have actually in their supply chain and in their treatment programs tenofovir emtricitabine. They have tenofovir lamivudine. So it's quite sensible, and procurement decisions do have an impact in decision making. So we're more than happy to discuss this, but it works.
Okay, thank you.
Yeah, any more questions? Many more questions. So please give me a sign. Get up to the microphone, please. So just help yourself.
Hello, everyone. I am Manuel from Italy, young HIV activist. I have a question about what could be the right attitude towards the government, because I think that the reason why PrEP is not still implemented is it's because it's not useful for white heterosexual cisgender men that rules our lives and protect MSM community and vulnerable communities does not bring votes to political parties. So as activists, I really struggle with myself about what is the right attitude to obtain things, because a part of me wants to be clever, want to fake it until I make it, but a part of me wants to go under the parliament and call the politicians for what they are, people who are letting vulnerable population get it infected to not spend money on them. So what do you think about that?
In the first place, I think WHO is a good ally in this, but will Nutland maybe have some ideas to answer?
So primarily I would like to say, we should use it on a human rights-based argument, that we have the right to good health care, regardless of who we are. I'm not sure that's necessarily going to win the argument. And the argument that I think might be worth using is cost effectiveness. Our governments like to hear when they can save money. So there's now incredibly robust cost effectiveness data, both on using generics and non-generics, and I would use that argument. If you can target PrEP into these communities of people, not only will it make them healthier, but it will save our government's money in the medium to long term.
I just want to underscore that. It costs, kind of say if you have to have 5 minutes with your Minister of Health, make sure you have done sort of a cost effectiveness, that I can break it down for somebody who may not really understand this. I mean, that's, ultimately it's about health budgets, and, this is what I kind of say. It's being like, oh, sorry. It's like, well, look, if this kid seroconverts on your watch, you're going to pay for their HIV treatment for the rest of their lives. I mean, it's blunt, and I don't like saying this to somebody in government, but it's like, prevent that infection.
Interesting bedfellows, cost effectiveness and human rights. Tamas has got a question. And
I have a question, and I come from a low prevalence, from an HIV low prevalence, which is peculiar in many regards right now, so I will not really use it as an example, but how do you handle the situation when it's the doctors, it's the medical community who do not support prescribing PrEP for moralistic reasons, which we heard from Louise. And they say, I mean, even the lead HIV doctor in Hungary says that gays just should have less sex. It's just, this will teach them a lesson. That's what he says. So how do you handle that situation? And then you say we should go to the Minister of Health. We don't have a Minister of Health. There's no Ministry of Health in Hungary right now. Seriously. So what do you, I mean, we have a Minister of Human Resources, and then health is just one of the departments in the ministry. So how do you handle a situation which is that complex, that HIV is not even on the agenda at all, let alone prevention. So it's not something that people care about. And so what's the suggestion? I know you
million euro question.
You're obviously not in a favorable position as a country. So, in pragmatic terms, it's quite sensitizing. Again, I mean, maybe the glass is a quarter full, I would say. I'm sure there's like a bit enlightened providers. Maybe they're not the lead HIV specialists in the country, right? So it could be, you need to think about also going outside the HIV space. So you need to think about maybe some primary care physicians, some gynecologists that actually quite be a little more reasonable about this, and get people who are offering, in other specialties that may actually be much more sensible and evidence-based, rather than, again, moralizing this.
I'm counting on people like Will Nutland and all of you to think out of the box and to find ways to address the right people. As time is running short and Gus has come close, he's just teaching me to wrap up. So I say again,
Jim had a question.
A very short one, a very brief one.
I was waiting there.
Oh, sorry, I haven't seen you. Even though time...
My name is Kiromidi. I am from Tajikistan, in one of the eastern countries of WHO region. My question goes to the UN agencies, probably the WHO, regarding your guidelines and all these tools, and you already so far did very well around the PrEP. But what about the introduction of all these guidelines and good practices to the countries such as Central Asia, Tajikistan, Uzbekistan, the other Central Asian country? What the steps you are taking to introduce them to the PrEP as a WHO or other UN agencies?
Okay, so we take the next question as well to make it shorter and quicker to answer. So come up here, and then this is. I'm sorry.
Hi, I'm Jim. I author Quiero PrEP. I'm never quite sure why, as the foreign Brit, I've ended up writing the Spanish website, but there we go. It's just on the discussions there, pricing of generics and availability of generics. And Ferran might correct me here if I'm talking incorrectly, but in Spain we have the additional barriers that generics are limited both in their availability. You can't even go out and buy them in pharmacies. They're restricted for hospital issue only. So there must be other countries similar to that. And one of the things, I'm not necessarily planting it so much of a question as how do we deal with this in these next couple of days. Perhaps tomorrow in the breakout it would fit in with strategy. But how legislations, is this something we can pick up with international organisations back up going into the EU level to say we've got to actually remove these legal restrictions? Because for me to import, as in many other countries, into Spain via the post is illegal. Carrying it in my suitcase is just about forgivable. But even if the generic was available cheaply, can't actually just go to a pharmacy and buy it in Spain. And I'm sure that applies in many other EU countries. So how, as a group, can we take that forwards during these 2 days and use the international organisations that are on side to try and break down those legal barriers?
I don't know whether my colleagues up here have a cool answer on this, but one thing is for sure within the breaks, you mentioned that yourself, having the informal encounters and the breakout groups. And now I ask for a very quick answer, because otherwise I lose my reputation on time management.
Very quick. Question on that, you just always have to have a lawyer in the room, and when you're developing a PrEP implementation plan, strategy, troubleshooting, have a lawyer, because I think we discussed this. Australians also considered this. It can be a barrier, so you need a lawyer on your team. The other thing to our other friend, I think in terms of dissemination around our PrEP guidance, we're having a whole series of webinars planned in 2018, where we're trying to ensure that the WHO PrEP implementation tool actually reaches countries and regions. So we're trying to support that work. That's it.
I got nothing more.
So thank you again. One huge applause for Yannis and Will.